I don't know, do we call you a herd, a flock? What is it of speech therapists in the studio with us this morning? It's Indiana in the Morning on WCCS 101.1 FM, AM 1160, and WCCSradio.com. Good morning to you. Well, in the studio with us this morning, we've got three ladies who are going to talk to us about May being National Speech Language Hearing Month. They come to us from IRMC. Let's say hello this morning to, let me punch the button here, Jen Cunningham is with us this morning, Renee Fabian, and Catherine Wojtowicz. Did I get it? How close?
Pretty good.
I'm only saying that once. I'll have you know. Okay, so it's May Speech Language Hearing Month. You are all speech therapists. What is the office name, Jen? Is there an office?
We're in with the physical therapy and the occupational therapy. Okay. So it's rehab services, therapy services, and then we're just the speech therapy. Gang.
I didn't know. It's a gang.
Gang.
I wondered. Flock, herd, whatever it happens to be. Gang. I like that a whole lot better. Well, when you get right down to it, you really do. You gang up on a problem here, don't you?
That's right. Absolutely.
Yeah, that's how you do that. And so let's talk a little bit about this month and folks who are suffering from, particularly I'm thinking of speech, and the difficulties that people have that can come from any number of reasons. It could be something that they're born with. It could be something that comes on as a result of an accident or
stroke.
A stroke. Yeah, all of these different causes.
Yes.
You're in the business of helping them recover.
Correct. Yes. Yeah. I think a lot of people think of strokes when they think of the adult population. And then when they think of kiddos, they think of, articulation. But there's a whole lot we do in all, both outpatient and in inpatient and on the rehab unit.
Mm-hmm. And Renee, when we're talking about this, we are talking about all ages, correct?
Yeah, we can have outpatients as young as,
two
and to as old as 90 in a month.
Uh-huh.
Yeah.
Yes.
Yeah.
All the ages.
And we talked about various causes, obviously with an older population. The cause might be a little bit different than with somebody who's very young.
Correct. Yes. Yeah. The kiddos, it can be autism. It can be language delays. It can be feeding issues. It can be articulation, of course.
Yeah.
So, or motor planning problems.
That might be something that we really don't think of. But Catherine, when we do think about it, people who have breathing tubes, people who have devices that help them to eat and to feed, people who have had any sort of medical emergency that has affected their speech. Communication for them, it can be very frustrating, can it? Because they've spoken just like most people do all of their lives, and all of a sudden that's taken away from them.
Right. Yeah. So oftentimes, a big population that we see in the hospital are patients who've had strokes, and those deficits can vary. If it does affect communication, it could be mild, or it could be very severe to where they're not able to get any or very few words out. So oftentimes we're there to find what means of communication they still have and what areas are affected. We might be using communication boards, pictures that they can point to help them get their functional, wants and needs across.
Yeah. Cognition is a part of the question as well, too, isn't it? Because some people they retain their full cognitive abilities, but they don't have the ability to speak it and to get the words out. Some people, their cognitive abilities have suffered along with their speech, correct?
Right, yeah. We do address maybe just orientation, getting the patient oriented to place, time, situation. We work on memory, problem solving, so that might be implementing strategies to aid memory, working on functional problem solving things like figuring out time, money, finances, situational problem solving, things like that.
Yeah, Jen, when we think about patients who have lost the ability to speak, as opposed to someone who never really had the ability to speak clearly, and trying to help those patients, the approach has to be different.
Very different, yes. Yeah. The kiddos we see, well, again, we may we may have to get a device for them so that they can communicate to kind of bridge the gap. It does not prevent them from being able to express themselves verbally in the future, but it just helps kind of take care of the frustration. So they may use a device. Some people, some kiddos will use a device for the rest of their lives. So yeah, we do that as well in outpatient.
Yeah, Renee, talk if you would a little bit about somebody, particularly thinking of younger folks who have never had the ability to hear, and maybe they have a cochlear implant now, maybe they do not, and they still don't have the ability to hear, but teaching them to speak and to learn a language that they never have heard or heard clearly. That's a challenge.
It is for sure. But it's also like a blessing too. It's just to experience that with them, to teach them the new sounds from the start. I haven't dealt too much with someone with a cochlear implant, but I mean, I think just teaching any little kid to talk or things like that, it's every session you can see a little bit of improvement, and it's just very rewarding.
Yeah.
That's the word.
Yeah.
Yeah.
You celebrate the wins, don't
Yes,
you?
yes.
Yeah.
So,
And you help them to realize as well that, you know, that's an accomplishment. It's a step forward, and it's a major step forward for them. It's breakthrough.
right.
Yeah. Breakthrough moments, I'm sure, are a very big part of what you do. Tell me about a couple of other terms. Aphasia is one of those that I've heard, but I don't really understand what it means.
So aphasia would be a language disorder affected by a brain injury.
Okay.
It could be expressive language, so getting words out. Writing can be affected, as well as receptive language, so their ability to understand what they're hearing, as well as ability to read.
Is stuttering also a part of what they could get from therapy as well?
It is, yeah.
Yes.
More
Yes.
so
Yeah.
outpatient.
Especially, little kiddos. We'll see real young and before they're, kind of truly stuttering in the way of struggling, to sort of prevent that from happening. And then even, the older kids.
Yeah.
It's kind of solidified with.
You know, it's interesting. We just had a conversation with another group in here talking about mental health and stigma that is associated with mental health problems. With speech, that can be, especially for a child, there can be a stigma there that really affects them as well, and giving them that confidence to finally begin speaking and communicating. That has to be a really triumphant moment for them as well, but it has to be really difficult too.
Yes, and confidence it plays a major role, especially with the kiddos. Just getting them to trust that it's okay to try and fail, and we'll try until we get it. To just have that confidence that we're going to get there. That's an obstacle sometimes for sure.
Yeah. Renee, we think of school problems and them having difficulty in school. And how speech can affect your learning right up and, other subjects, certainly, and being around other students, especially when you're so young. But that has to, for them, that confidence factor has to really play a major role in their abilities to be comfortable in school.
Yeah, you do find, like, in sessions with younger kids, like, they talk about at school, maybe some other kids not understanding them or making fun of them at certain points for certain sounds they say. So you also, you're teaching them how to do the sound correctly, but you're also counseling in a way, trying to show them that it's okay and that we're there for them to work on that. And so you're working against a few different things, but I like that challenge in a way. Like, you also want to make them feel, like Jen said, comfortable. And that way they know that they can work on it with you to get better.
May is National Speech, Language, and Hearing Month. Catherine, you mentioned a brain injury a couple of moments ago. And we think of stroke, that's certainly brain injury, but even car accidents, especially if they've not been belted up and they hit the windshield, things of that nature, any of those sorts of injuries that can happen to somebody. I'm thinking as well of concussion in a football game when you take a hit to the head. All of that can affect speech, and maybe we don't even realize it.
Right, yeah. Any of those can affect speech, cognition. Swallowing is also a big part of what we do. People are often surprised by that when we show up in their hospital room and say we're from speech therapy, but we're here to see you for swallowing. But it is a big part of where we spend our time at the hospital. So oftentimes we're assessing patients at bedside. You'll often find us breakfast or lunch with patients at meals, looking for signs or symptoms of aspiration or things going into the airway, food or liquid going into the airway as they're swallowing. So we're looking for those signs and then maybe adjusting the consistency of their food and liquid. At that point, if we are seeing issues, we often recommend a swallow test on an X-ray video where we can watch them swallow, looking to see if anything is going into the airway. We may be trying different strategies that can eliminate that. And then again, looking at the different consistencies and seeing what they can swallow safely.
Yeah. Just a minute left as we talk this morning about speech, particularly. Jen, when we think of folks who are really, really eager to regain their speaking abilities, the level of effort that they put into it is really, really important, is it not?
Oh, absolutely. And in fact, I mean, research has shown that even people with more family support or friend support, the more support they have, the better their outcomes. I mean, that isn't surprising, but the effort, they have to practice every day, which is not easy for them. It's very frustrating.
Yeah. But when somebody's session is over, and I know it's going to be case by case, but when somebody's session is over and you leave and they get back to practicing and trying some of the techniques that you've learned, taught to them, they might be really looking forward to that next session. Are there people that really want to get right back into the next session?
Oh, yeah. There for sure. There are people who say, they want longer time slots and more frequent. And yeah, absolutely.
Yeah. I would guess family members too are going to be a really big part of their recovery.
Yes. And we try to, always educate, whether it's in outpatient or in acute care, to educate everybody that's playing a role.
Yeah. All right. So somebody at home who maybe hasn't suffered an injury of some sort, but they recognize in themselves or in a family member that they need some speech therapy, they need to be able to communicate better. What should they do in relation to how you can help them?
So the outpatient arm of IRMC for physical, occupational, and speech therapy is Indiana Total Therapy. So we're at the location by the hospital, and they can contact us, but they will have to have a script, a referral from their physician.
Okay. All right. That's the easy thing to do then.
Yeah.
You're in the HMI building?
Yeah.
Very good. Very good. Ladies, thanks so much for coming in.
Thank you for having us.
We appreciate it very, very much. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. See, I've got three pros with me, so I figure I have to really enunciate clearly here today and say my S's correctly. It's 8:26. Boomer Sports next. Matt is in the newsroom.